Hello, my name is Kirshna Cabradilla and I will be discussing about Colorado tick fever virus. The Colorado tick fever virus is a double-stranded RNA virus that belongs to a genus Cultivirus. It is a member of the Rheoviridae family. Subfamily is Spina-Rheovarinae. It is belong in the kingdom of Orthornavirae, and it has approximately 60 to 80 nanometer in diameter. It is in linear arrangement, has a smooth surface, and non-envelope. It has a spiral shape with icosahedral symmetry. It has two concentric capsid shells, baryon enclosed of a core of approximately 50 nanometer in diameter. The tick-borne virus can cause other disease like the following: Rocky Mountain spotted fever, Lyme disease, tick-borne relapsing fever, ehrlichiosis, anaplasmosis, babesiosis, Borrelia mayoni, Borrelia Miyamoto. The common tick disease in the United States is the Lyme disease and the Colorado tick fever disease. The Colorado tick fever virus most active during warmer months. The virus is inactive on approximately 50 degrees Celsius. The tick can be found in shrubs, grassland, biking and hiking areas, and also in wooded places. Cases are reportedly significant in Arizona, Utah, Wyoming, Colorado, Montana, and Oregon. Colorado tick virus die in acidic environment, about pH of 3, and stable on about pH of 7 to 8. People who work outdoors and engage in outdoor activities are at risk. The reservoir is the tick and commonly transmitted to small rodents like chipmunks, mice, and squirrels. The tick is transmitted by Derma centaur andersoni caused by Rocky Mountain wood tick. Transmitted to human usually by a bite of an infected adult wood tick. No human-to-human transmission recorded yet, but in rare cases can obtain in blood transfusion. After having Colorado tick fever, a person cannot donate a blood within 6 months after cure. The commonly symptoms of Colorado tick fever are fever, chills, headache, body aches, and feeling of tired. Some patients have sore throats, vomiting, abdominal pain, or skin rash. Incubation period is 1 to 14 days. In rare cases, some patients may develop more severe illness affecting neurological system, meningitis most common in the children, and encephalitis, and also affecting central nervous system that can cause stiff neck and confusion. Unfortunately, there is no medication treatment for Colorado tick fever virus infection, no vaccine. Most cases is resolved on its own within 10 days. With severe Colorado tick fever cases, hospitalization is required. Treatment may include IV fluids and medication to alleviate pain and fever. To prevent getting this virus, we need to know where is the tick commonly found. Environment like wooded places, grassy, shrubs, hiking or biking trails, and also in camping grounds. If we really cannot avoid going to these places, we should treat our clothing and gears. anti-repellent with 0.5 permethrin containing products. We can use it in our own clothing, boots, and gear, and can stay away from the tick. And do not forget to inspect your clothes and check your body for tick after being in a place that potentially tick infected. Use full mirror to view all the parts of your body, includes underarm, in and out of your ear, inside your belly button, in your hair, in your back knees, and also in between your legs. On the left picture is the male and female tick. The left is the female tick and the right is the male tick. On the right figure is the picture on how it looks like in microscopic image. Left figure is the area where the cases of tick highly observed. Right picture is the Colorado tick fever rash look like. The following slides are my references. Thank you, and hopefully you like my presentation and understand some about Colorado tick fever virus. Again, this is Krishna Cabradilla. Thank you.